All right. Good afternoon, everyone, and welcome to another social emotional workshop. And today we are going to be talking about opioids and prescription drugs. We have Lisa from Henry Ford Health Systems with us to facilitate today. Lisa, we're so glad to have you back. Thank you.
Thank you. I'm happy to be here. And I apologize for the mistake I made last time when I didn't have it on my calendar.
No worries.
So Henry Ford Health System is now called Henry Ford Health. They changed the name. And what I'm going to do is I'm going to share a PowerPoint if I can, and if not, that's okay. We'll figure it out. So we're going to talk today. Can you see that, Tony?
Not at all.
You can't see that. Okay. Never mind then. Okay, so we're going to talk today about the opioid epidemic as well as prescription medications. So just as a refresher, remember that addiction is a disease. It is not a choice or a character weakness or character flaw. It's not a criminal mind. It is truly a genetic disorder. It's a mental health disorder as well. And it is unfortunately very, very common. So what happens when people are addicted is that the reward center in their brain gets tricked into enjoying the feeling of the substance. And we're going to talk about that further as we speak about opioids. So we have an opioid epidemic. I'm sure that everybody knows that. It is a public health emergency. It's impacting all areas of our society, including businesses and government, criminal justice system, foster care, schools, healthcare, and families. So when we're talking about opioids, we're talking about prescription pain medications. I'm sure you've heard many of these drugs: Vicodin, morphine, oxycodone, Oxycontin, Percocet. You've heard of these class of drugs that we call pain medication. And the way they work is that they help, they attach to the reward center in a person's brain. And they're very effective when a person is in physical pain. That's why doctors prescribe it for surgery or recovering from surgery or dental work. So it does a really good service in managing people's pain. The problem with it is that for some people, it makes them euphoric and they love the feeling. So those are people who are more likely to become addicted by using it other than prescribed. So being familiar with the signs and symptoms, a person who is under the influence of opioids is going to have pinpoint pupils. They could be nodding off in the middle of a conversation. Oftentimes people who are using regularly become very thin, lose weight. You're going to see people who feel like little bugs are crawling on them, so they might be scratching their skin even though there's nothing there. People who are sniffling. So there's all different signs. And if you're concerned about someone you know, you want to look up the signs and symptoms of opioid use. So how does this happen? Well, some people are prescribed medication by a doctor for a legitimate medical problem, like surgery or dental work, and they follow the doctor's directions exactly as written. And yet they could still become dependent on the drug. That does not mean that they are addicted, but they are physically dependent on the drug. Some people follow a doctor's prescription, but the doctor has given them too much for too long of a period of time. And those people too, even though they're following the doctor's directions, could develop a dependence on the drug. That does not mean they're addicted. So how do you know if someone's addicted? Well, that's when you cross the line into seeking it out. Okay, so what that could mean is going from doctor to doctor or from pharmacy to pharmacy to doctor shop or pharmacy shop. And that's not as easy as it used to be, because now there's a system in place called the MAPS system, MAPS. It stands for Michigan Automated Prescription Service. So any doctor or pharmacist is required now, it used to be voluntary, but now it's required to look people up. So they're going to know if I'm at CVS on Monday and Rite Aid on Tuesday and some other pharmacy on Wednesday. And they're going to notice how many different doctors I'm going to for these medications. But someone who's doctor or pharmacy shopping has likely crossed over the line into addiction. People buy it on the street. You can buy them over the internet and have them delivered to your front door. And in the case of teens, have it delivered to your friend's front door, because your parents may be on to you, but your friend's parents aren't on to him or her. And then open houses prior to COVID, if you were selling your house, people would come into your house under the guise of looking for to buy a house. They'd use your bathroom, they'd clean out the medicine cabinet, and by the time you return home at the end of the day, your medications are gone and you have no idea who's been in your house. So addicts typically do that. So that's how they obtain these medications. So what happens over time is that when someone starts using it, their tolerance goes up. So they need more and more of the substance to achieve the same effect. And pretty soon they are using to feel normal, not to get high anymore, but to feel normal, because if they don't use it, they are going to have very, very uncomfortable withdrawal symptoms, which are like the worst flu you've ever had and then some. So who wants to feel that way? Nobody. Well, what happens with these pills is sometimes they become inaccessible or too expensive. Okay, they could be up to $80 a pill on the street. So who's got that kind of money? So what people learn to do then is to turn to heroin. Heroin is a cheaper alternative and it's easier to obtain. So with heroin, it can be injected, it can be snorted, and it can be smoked. So what's happening now, unfortunately, is that the street drugs like heroin, or really any pill, is being laced with fentanyl. And fentanyl and another one, carfentanil, which is actually an animal tranquilizer, these are way stronger than morphine and they are killing people. And that's why we have an opioid epidemic. So unfortunately, people are dying. I just had a neighbor die from an overdose, feeling really sad about that. 27 years old, great family, just very, very sad. So there is treatment for people, whether or not they have insurance, doesn't matter. If they have private insurance, that will likely pay all or part of the cost. But people who don't have insurance can still get help through their county's community mental health program. Every county has a pool of money available to help people who are indigent or on Medicaid and sometimes underinsured. So there's something called medication-assisted treatment that can help people who have opioid addictions stay in recovery. And these medications are prescribed by a doctor and they're monitored closely. And if a person follows the medication regime, they can stay in recovery and live their life, go to work, go to school, take care of their kids. And the idea of medication-assisted treatment is not to be on it forever, but to be on it long enough to give a person's brain a chance to heal from the addiction and give them time to learn recovery skills and develop a support network so that they can be okay once the medication is discontinued. So there's also something you should all be aware of is a drug called Narcan. So Narcan is an opioid blocker. I carry it with me. I got it for free. Anybody can get trained in using Narcan. And what happens is if I were to approach someone who had an overdose and I were to administer this nasal spray, I could save their life. Because what I would do, the spray will block the opioid from having an effect. So in other words, it would take away their high. So I've been carrying it with me for several years now. Thankfully, I haven't needed to use it, but any of us can have it. And I got trained through my local drug prevention coalition, which in Wayne, Oakland, and Macomb County, they're all over the place. I don't know how plentiful they are in outstate regions, but if you called your community mental health network and asked them, how can you get Narcan training and free Narcan, they will be able to tell you. So what do you do about the pain if you don't want to take pain medication? Well, there are so many different holistic medications that can help with pain. Everything from aromatherapy, massage therapy, guided imagery, yoga, meditation. There are so many. So if you are interested in learning more about that, you can Google alternatives to pain medication or alternatives for pain management, and you will see many, many different techniques that people can use so that they can avoid being exposed to these opioid medications that could be potentially dangerous. So let's talk about prescription medications as well. So any medication that is prescribed by a doctor, usually for things like attention deficit disorder, anxiety, these drugs, if used properly and medically monitored, can really help someone with a medical condition. The problem is they're being sold on the street as well. And even people who are prescribed it sometimes sell it to others. And taking someone else's prescription is against the law. So what happens is now these medications are also being laced with fentanyl, and people are dying. So it's not just opioids anymore. People can die from taking Xanax purchased off the street. We're not talking about the type of medication that you would get at a pharmacy. We're talking about buying it off the street. So prescription medications are incredibly dangerous. What people often do is crush them and then snort them. And then the impact of this is instantaneous, okay, because it quickly absorbs into the bloodstream. So being really aware of that, families need to know that if they are no longer using any type of prescription medication, we're talking about any type, any sedative, any amphetamine, any opioid, they need, if they're no longer using it, they need to get it out of their house, because we don't want access for kids and kids' friends. Now, here's the issue. What do you do with it? They used to tell us to flush it down the toilet, and now they're saying don't do that because it's getting into our water system and it's impacting the fish that we eat. So what do you do with it instead? You take the medication to a drug take back day, which are a couple times a year. Most sheriff's departments and some police departments sponsor these programs, and they publicize it in advance. And the idea being getting the drugs off the street. I will tell you, my local police department has in the lobby, it looks like a mailbox, and you can bring any medication at any time, no questions asked, and they will properly dispose of it for you. Some pharmacies offer these bags called Deterra bags. So people put their unused prescription medication in a bag, and the chemicals in the bag break it down so that it's no longer harmful to our environment and nobody can use it anymore. So the idea being dispose of them safely. And think about this, if someone in your family dies, they likely have lots of pain medication, morphine and other types of medication available to them that people could take. Okay, so you want to be really aware. And as silly as this sounds, drug addicts learn who is having a funeral when they're away from the home, and then they come into the home and take these medications that haven't yet been disposed of. So an addict is very clever and creative, and when they're desperate enough, they will absolutely do what they need to do. So what kind of help is out there? So in the Tri-County area, and I don't know where you're all from, but there's a program called Hope Not Handcuffs. That means any person who's addicted can show up at a local police department or sheriff's department and say, I need help. They will not be arrested. They will have an angel who is a trained volunteer help them complete paperwork and get them into a drug treatment program. Okay, no arrest, because the law enforcement community recognizes that it cannot arrest its way out of drug addiction. So Hope Not Handcuffs is one program. Another one is Michigan State Police Angels, same idea. I'm going to guess in outside of the Tri-County area, they have more, they're more likely to have that. Local circuit courts offer drug courts, where people who have drug addiction are very closely monitored and have very strict, stringent rules that they must follow, and they're monitored and they show up in court every week in front of the judge. And there's different levels that they can achieve to the point where they graduate from a program called drug court and they are continuing to do well. So I will tell you, the people I know who have done drug court, they say it's very time consuming, it's very stressful, but it works. And they're saving a lot of money by instituting these drug courts instead of putting people in jail and arresting them and rearresting them. So another program that is real strong in the Tri-County area, but it may be in other parts of our state, I believe that it is called FAN, F-A-N, Families Against Narcotics. They do all sorts of advocacy for people who have addictions. They have supportive programs for families. They do programs in schools. They're really a really great network. So if you're interested in learning more, you absolutely want to look up Families Against Narcotics. So with that, if you are interested in learning more about opioids, there's an excellent YouTube video. It's called Chasing the Dragon. And if you want to learn about opioids or any other prescription medication addiction, the Narcotics Anonymous program often has what's called open talks, which are open to the public. What that means is a person in recovery gets up in front of a group and tells their story. They talk about how did their addiction start, progress, how bad did things get, how they found recovery, and how wonderful life is now. And I will tell you that it's a very uplifting, inspirational story always, and it gives people hope. So if you know of anybody who could benefit from that information and benefit from some hope, that would be a great thing for them to attend. So with that, I think we will open it up to any questions or comments that anybody has about opioids or any other prescription medication.
Lisa, you just spoke about the group Open Talks. Who is that program through?
Narcotics Anonymous or Alcoholics Anonymous have open talks regularly. But if you want to learn specifically about the drugs, you want to attend a Narcotics Anonymous open talk.
Okay, okay. And then you also mentioned earlier, you said fentanyl. Did you say it was a animal tranquilizer?
Carfentanil.
Carfentanil.
So
okay.
fentanyl and carfentanil are way stronger than morphine. As
Okay.
you know, morphine is given for pain. It's also given for people at the end of their life. And so imagine that multiplied by 100. Think about how strong
Wow.
these medications are. And that's why people are dying. Our bodies can't withstand that. And I will tell you, in the treatment program that I work at, we do have patients who are addicted to fentanyl. And I don't know how they're alive. I'm very grateful that they're alive, but
Wow.
they're really taking a huge risk with their bodies.
Wow. You guys have any questions? You all have the ability to unmute and speak, or if you like, you can type your question in the chat.
This was a wonderful presentation. I really appreciate this very much. I think the information was fantastic. I was pretty shocked the last time I had to get some medication for my dog that my license had to be entered into a database for that. And I was confused, but now with your presentation, I'm understanding that more. And I also want to thank you because I'm listening to some of these programs and thinking how much I would like to become involved as a volunteer. So thank you.
So Lisa, where do you live? What
Macomb
city?
County.
Oh, okay. So Macomb County is wonderful. They have Families Against Narcotics groups. They have drug prevention coalitions. The Chippewa Valley Coalition is one of the strongest coalitions in Michigan. I don't know
wow.
what city you live in.
That's my school district. So
okay.
Yeah.
So absolutely. Do you know Charlene McGunn?
I do not.
Okay, so she's the director of the coalition. If you contacted her and said you'd like to get involved, you want to volunteer, she'd jump at the chance.
Oh, thank you.
Also, you guys, through Care of Southeastern Michigan, they offer free Narcan training classes and certify you to be able to administer the Narcan if you encounter someone that may need it. I took it last year, and it was really freaking me out, because to think that you have someone's life in your hand in that moment, it's just mind blowing.
Yeah. So let me say this about that. I took the training and I told them I don't want the Narcan. I don't have anyone in my life, thankfully, who's addicted to opioids. So I want to save it for someone who does have someone. And I was asked, do you go to Starbucks? Do you go to the library? Do you go to the gas station? Well, of course I do. They said anybody could fall out anywhere. It may not be your family. So then how do you know if you should administer it or not? Well, the truth is it will not hurt them. If I suspect, or even if I'm just guessing this person had an opioid overdose, if I administer the medication and that's not what their problem was, it will not hurt them. But you always call 911. And when 911 comes, oftentimes they have to re-administer it because the person falls out again. But the emergency people have it in injectable form. People like us get it in a nasal spray. And I hope, Tony, I hope you never have to use it. I hope I don't
So
either.
do I. Oh my God. It's so scary to me. It's like,
I know.
oh my God, you know?
I know, but there is a Good Samaritan law as well. So if you do something as a Good Samaritan and you do it wrong, you can't be sued, you can't be arrested. So you're protected.
Wow, wow, wow. Any more questions, you guys? Please feel free to jump in. Oh, question in the chat. Lisa, if you could send me a list of the contacts, and then I will disperse it to everyone here.
Okay, so what I'll do is I'll send you a list of the different types of programs, but
Yeah.
depending on where in the state you are, the contact person is different. So
Yeah,
you'll have to look it up in your area, because I know that you guys are all from different parts
yeah,
of Michigan, right?
yeah. Wayne, Oakland, and Macomb.
Yeah. And I remember you had someone from West Branch on a
Yeah.
previous one. So yeah, so I don't know all of them, but I can tell you where to find them for sure.
Okay, good deal. Thank you. So Lisa will send me the information and I will send it out to you guys. Questions? Any other questions, comments?
No, again, this was a really wonderful presentation. Thank you.
Okay, you're welcome. Let me just say this about the kids that you work with. Many kids think that these pills are harmless. They're very small. They might see their parents using them. They might see their peers using them, but it has to be instilled upon them that if you're buying it off the street, you don't know what's in it. Okay, and that's the scary thing.
Wow. Wow.
Not to
All
say
right.
it's safe if you're getting it from a pharmacy. It's not
That's-
safe for them, but on the street, it's incredibly dangerous and they could die.
Yeah, yeah. Okay, you guys. Well, if you don't have any other questions or comments, then we will wrap this up. Lisa, thank you again. Presentations are always excellent. We love having you here, sharing the information on all of these various topics. It's been so helpful.
You're
thank you.
welcome.
Thank
And
you.
can I say one other thing?
Mhm.
If any of you or any families you work with or your own family, if anybody needs to talk to anybody privately, I am happy to talk to them. All they have to do is call Henry Ford Maple Grove Center in West Bloomfield and ask for Lisa, the social worker. So there's two of us. One is a medical professional on the second floor. So just ask for Lisa on the first floor or Lisa, the social worker. And if you know of anyone who's struggling with addiction or a family member who's struggling, I can help them.
And you guys, you can always contact me and I'll give you Lisa's direct information so that you can reach out and contact her. So with that being said, we're going to wrap this up. Thank you guys for joining. Thanks, Lisa. And we'll see you all next time.
Thank you.
Bye now.
Bye-bye.